So more than 1 million Kiwis have continence issues. 10% of people can experience urinary incontinence, that's of the bladder, at some point in their adulthood, including males. 10% of New Zealanders can have bowel control issues. So what are the risk factors for pelvic floor disorders? Well, we know definitely pregnancy and childbirth are key risk factors, particularly a vaginal birth. But it's not just mothers or women that can have pelvic floor disorders. Could be athletes, courier drivers. So anything that increases the abdominal pressure here and puts a downward pressure on the pelvic floor can kind of push it to the point that it's kind of overloading and then it can't function as we want it to. So it could be, you'll be interested to know, repeated lifting of heavy loads, high impact exercise, trampolines are definitely the worst, and even the men Olympian trampolinists will have pelvic floor or incontinence issues. Chronic lung conditions resulting in coughing all the time, that force, that high pressure goes down on the pelvic floor and it just can't match it or keep that functioning. Chronic constipation is another way that you're just constantly putting downward pressure on the pelvic floor. Menopause with hormonal changes can change our tissue type. Obesity, so the weight. Smoking, and also neurological disorders as well. So things like Parkinson's disease and multiple sclerosis can have bladder issues, pelvic floor issues. Connective tissue abnormalities is two, like Ehlers-Danlos syndrome, will also influence pelvic floor. And there is can be a strong genetic kind of link. So pelvic floor disorders does not just equal incontinence. So signs and symptoms, as well as leakage of urine, stool or gas, could be frequent bathroom visits, pain when passing urine, or poor flow or inability to completely empty, difficulties emptying the bowel and constipation, heaviness or dragging in the pelvic region or vagina, painful sex, erectile ejaculation difficulties, or just pain in the lower abdominal, pelvic region, the genitals or rectum. And it can also relate to unexplained lower back pain too. So pelvic floor disorders. So the most common are incontinence of urine or bowel. There's also pelvic organ prolapse that we'll talk a bit more about later. Sexual dysfunction and pelvic pain. So behind that, there's a lot of different conditions that can occur or contribute to the disorder. So gynecological conditions such as endometriosis and polycystic ovary syndrome. Gastrointestinal conditions like irritable bowel syndrome. Urological conditions like painful bladder syndrome, or cystitis, or urethral syndrome. Colorectal conditions, so we know about constipation, but also hemorrhoids and rectal fissures. And then also musculoskeletal conditions too. So this might include coccydynia or tailbone pain, or pelvic girdle pain, or piriformis syndrome. And then there's neurological or vascular conditions that can affect the nerves down there too, such as the pudendal nerve. So there's significant unspoken social impacts of pelvic floor disorders. They can be obviously socially embarrassing and can cause depression. People will become shameful, lose their confidence, and just have a sense of lower sense of well-being. It can mean that they withdraw both socially and for sporting activities, and can impact their work too. There can be a sexual dysfunction, so affecting their relationships. And then it can impact financially with the cost of pads or bedding or laundry, all of that, the impact on work. It could be loss of sleep. And then even things like falls and fractures can be more prevalent when they're rushing to the toilet. So in the older population, that's common. And overall just reduces the person's quality of life. So there's a bit of a hidden burden of women's health. Yes, men have pelvic floors too, but we know the problems are less common, and then they don't have the effect of going through pregnancy and childbirth that can have a big effect. So the pelvic floor disorders kind of forms an umbrella under all these conditions and symptoms can fall: urinary incontinence, bowel incontinence, pelvic organ prolapse, and sexual dysfunction are key ones. Incontinence, we know, is 6 times more common in females than males. So the hidden burden statistically is that 1 every 3 women will experience bladder incontinence. 1 in 10 will have fecal incontinence. 1 in 12 women can experience a pelvic organ prolapse. 1 in 5 can experience pain during intercourse. And by time the women are older in life, it can reach 46% of people having a dysfunction of some sort. So there's different types of urinary incontinence. Stress and urgency incontinence is the most prevalent and account for 90% of the cases of incontinence in females. Stress incontinence occurs when the pressure above the pelvic floor is too much and there's leakage. So it can be from things like coughing, sneezing, laughing, or jumping. Urgency incontinence is where you have accidents kind of when you're trying to get to the toilet. So the classic case is going home, you get the key in the door, and then you just can't hold it, and there's leakage. Then there's a mix of those two, urgency and stress. And then also there's overflow incontinence where there's a difficulty to empty the bladder. Pelvic organ prolapse. So a prolapse is defined when an organ falls out of place. So a pelvic organ prolapse is when one of the pelvic organs, the bladder, the uterus, or the rectum or bowel, bulges or protrudes into the vagina. And grossly, there's kind of 3 sorts, demonstrated by these balloons. There's an anterior prolapse, where the bladder can come through into the vagina. Another name is the cystocele. There's a rectocele, where the rectum comes into the vagina, or also known as a posterior prolapse. And then there's a uterine prolapse, also called a vault, where the cervix and the uterus kind of come through from the top of the vagina. And the symptoms of a pelvic organ prolapse is a sensation of heaviness or bulging or pressure or kind of falling out. Might have difficulty voiding, so that's going to the toilet, either bladder or bowel, and then there may be pain with intercourse as well. It can be associated with pelvic pain and or incontinence, but it's not a symptom of the prolapse itself. So just in general, treatment options for pelvic floor disorders. So obviously pelvic floor exercise, so recommended for incontinence and can make a big difference to either improve or resolve up to 60 or 80% of women with incontinence. It's recommended they have a supervised pelvic floor training program over a minimum of 12 weeks. That's the first line of defense. Other factors are lifestyle modifications as well. So taking that strain off the pelvic floor and making that tissue as healthy as possible by losing weight, quitting smoking, reviewing diet, fluid intake, and exercise. We also use pain management tools. And for pelvic organ prolapse too, there's an option now for pessaries as well. And that's something the gynecologist or some specialized trained pelvic health physios can do. There's obviously medication, and as the last stop to help people, it's surgery. So why is screening for pelvic floor disorders important? Well, it's normalizing the topic of pelvic health. 84% of patients never report to their health professional that they're suffering in the general population. And also persistent lower back pain, it's been found up to 70% can have weak pelvic floors or dysfunctional pelvic floors. So how can you help screen for pelvic health disorders? Just keep in the back of your mind those symptoms, any leaking, heaviness, dragging sensation in the pelvic area. You might just ask them, is there anything you want me to be aware of that would impact your training? Any body challenges you're facing right now? To invite your client to raise any issues that you need to consider with their training program.